My name is Chris Atkinson. I'm a student of physical therapy at the University of Central Florida. This is my patient Kyle. Wave hi, Kyle. Today we're going to be assessing his ankle joint. So first thing we're going to do is assess his range of motion. I'm going to come down here towards his ankle joint. I have him laying down. I've got his knees bolstered so his gastroc is on slack, not inhibiting any ankle joint movement. And Kyle, what I need you to do, I need you to go ahead and dorsiflex as much as you possibly can for me, all right? Can you hold that for me? Mm-hmm. All right, so I'm gonna take my goni, I'm gonna place my axis just distal to his lateral malleoli. I'm gonna take my stationary arm and I'm gonna point it right at his fibular head, just like that. And then my movable arm is gonna be parallel to the sole of his heel. So I'm gonna do that, I'm gonna make that parallel. And I'm getting a reading of 22 degrees, which is above normal. Normal would be 20 in this case. So now we're gonna do the other motion, we're gonna do plantar flexion. So Kyle, if I could get you to plantar flex your foot as much as you can for me, point those toes as much as you can. I'm gonna come here, same axis, just distal to the lateral malleolus. Same stable arm right there, head of the fibula. And then my movable arm is gonna come down here and find the sole of his heel again and become just parallel to it. So if I bend over and take a look at that, I'm getting about 32 degrees of plantar flexion, which is a little bit below normal. Normal value would be 50 degrees normally. Okay, so that's range of motion. Kyle, go ahead, lift your legs up for me. Let me get this out from underneath you. Now I'm gonna come over here and we're going to assess the strength of his ankle muscles. So Kyle, thank you for sitting up for me. I'm going to lower this down so I can get a better vantage point on your foot. Over here. Go ahead, let me have his leg, put that on my leg. So we're going to be assessing 3 muscles in your ankle, the pronaeus tertius, and then the pronaeus longus and brevis. Longus and brevis will go together. So take this leg, go ahead, internally rotate your hip a little bit for me, and then I'm going to come with your foot down here. I'm going to ask you to dorsiflex it and evert it for me, all right? So can you hold that position? Mm-hmm. Okay, great. So he's holding that position in space, so that is a 3 out of 5 already. So I'm going to come down here, my left hand is going to be stabilizing his ankle, my right hand is going to come and grab his 4th and 5th metatarsals, and I'm going to pull him into the direction of plantar flexion and inversion, all right? So I'm gonna need you to not let me move you, okay? So go ahead and hold that position for me. I'm gonna apply some pressure. Hold, 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 okay. And I was not able to move him against moderate nor strong pressure, so he earned a 5 out of 5. Perfect strength. So I'm gonna ask you to keep this a little internally rotated. We're gonna do pronaeus longus and brevis this time. So I'm gonna need you to plantar flex as much as you can, and then we're going to evert you again, okay? Can you hold that for me? Mm-hmm. Great. 3 out of 3 right off the bat. Stabilizing the ankle again. This time I'm going to pull you into dorsiflexion and also invert you as well, okay? Mm-hmm. So don't let me move you against that, all right? Okay. So hold, 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 hold. Okay, and he resisted again against moderate to strong pressure, so that's a 5 out of 5. Sound good? Mm-hmm. All right. Now go ahead, stand up for me. What I'm going to do now is I'm going to assess the length of your gastrocnemius, your giant calf muscle back there, right? So I'm going to raise this table up, grab a different goniometer for appropriate sizing. So this left leg I need you to bring forward. This right leg I need you to maintain back there. Hold on to the plinth for balance. I need you to lean forward, keeping your right heel on the ground. So I need your knee straight, right heel on the ground, okay? And bend as far forward as you can. Okay. So I'm gonna come around, holding this position. I'm gonna get down here. Got my little goni, axis just distal to the lateral malleoli again. Movable arm with the fibular head, and the stationary arm is gonna be parallel to the floor this time. So, got that angle set up. Giving me a reading of 40 degrees. So, because you were able to get normal dorsiflexion, and we're still getting normal dorsiflexion, nothing is tight, and there's no tightness in his